Welcome to the deep dive. We're here again, sifting through the noise to bring you insights from some really crucial sources you might not see otherwise.
And today's topic is definitely one of those. It challenges a core belief most of us hold about health.
Right. This idea that more screening, more tests, especially as we get older, automatically means safer, better health.
Exactly. We've looked at a whole stack of research, medical reviews, transcripts focused specifically on geriatric health. And the big finding, it's a bit of a paradox.
A paradox. How so?
Well, for seniors, let's say particularly those over 70, the routine sort of annual checkup screening tests, they can actually cause more problems than they solve.
More harm than good. That sounds significant.
It is. It can lead to unnecessary procedures, invasive ones, sometimes lifelong side effects, and a lot of anxiety.
And the numbers we found in these sources are, frankly, pretty stark. Some studies suggest up to 37% of tests given to seniors lead to treatments or complications that weren't needed.
Think about that. More than 1 in 3 tests potentially causing harm.
And the really striking part,
Yeah, this is what got us. The sources claim 99% of people over 70 have basically no idea they're being overtested. That's the term researchers are using.
they're just doing what they think is right, following the standard advice for prevention.
Precisely. Assuming maximum testing equals maximum safety.
So let's be clear. We're absolutely not saying don't see your doctor. Not at all.
No, definitely not. But it's about equipping you, the listener, with the right questions to ask, to have a more informed conversation.
We've grouped the most concerning routine screenings highlighted in the sources into, let's call them 3 danger zones. We'll look at 5 specific tests.
And one of those tests, according to recent modeling studies we reviewed, might be linked to as much as 5% of all U.S. cancer cases.
Wow. Okay, let's dive into this. Hashtag, tag, IIA, tests that mistake aging for illness.
Sure.
First up, let's talk about tests that seem to confuse normal signs of aging with actual illness needing treatment.
That's a great way to put it. Our first example is one many women know well, the bone density scan, or DXA scan.
Right, measures bone strength, looks for osteoporosis. Seems pretty straightforward, harmless even.
On the surface, yes. Quick, non-invasive. But the issue highlighted in the sources isn't the scan itself, it's how the results are interpreted, especially after 70.
What do you mean?
Well, some degree of bone loss, what's called osteopenia, is almost universal as we age. It's like, needing reading glasses or getting gray hair. It's expected.
A natural part of getting older.
Exactly. But when that scan puts the label osteopenia on it, there's this pressure, almost an obligation in the medical system to treat it.
And that treatment usually means.
Bisphosphonates, drugs designed to stop bone loss.
Okay, but what's the real trade-off here? For someone who's generally active, healthy, just happens to show this expected bone thinning.
Well, the sources show the benefit is often marginal, really small, but the side effects, they can be pretty severe.
Such as?
Things like jaw necrosis, where the actual jawbone can start to die, and really bad esophageal irritation, heartburn, reflux, serious quality of life issues.
And the benefit doesn't always stack up.
One study we looked at, over 1,200 women over 70, found these drugs reduced fracture risk by only 0.3% over 5 years.
Tiny.
0.3%. That's very small compared to the potential side effects.
Right. Which brings us to the anecdote about Rose, 76 years old.
Yeah, the piano teacher.
Active, healthy, but her DXA showed osteopenia. Doctor put her on alendronate, one of those bisphosphonates. Within months, she developed terrible reflux, jaw pain. So bad she had to stop teaching piano. The treatment caused more problems than the condition ever would have.
So what's the alternative the sources point to?
Lifestyle, primarily. Focusing on things we know work. Vitamin D, getting enough calcium, and crucially, weight-bearing exercise. Even simple things like resistance bands.
And does that actually work as well?
Better. According to one big study, it found those lifestyle approaches could reduce fracture risk by over 20%. Compare that to 0.3% from the drug.
20% versus 0.3. That's a huge difference.
It really is. It shifts the focus back to foundational health. Okay, so if DEXA scans risk labeling normal aging as disease, what about brain MRIs for, say, mild memory slips?
Ah, yes. This one highlights the emotional cost, the anxiety of over-imaging.
The fear of Alzheimer's is huge, isn't it? Someone misplaces their keys, forgets a name.
Instantly, the fear is dementia. So they push for an MRI, just to be sure.
But what do those MRIs typically show in cases of just mild age-related forgetfulness?
Usually just normal signs of an aging brain, maybe a little bit of shrinkage, some tiny white matter spots, things that are common and often don't correlate with severe cognitive decline.
But seeing that on a scan report, Even if the doctor says it's age-appropriate, that must cause panic.
Exactly. It triggers what the sources call a procedural cascade and anxiety. A 2021 study found 97% of these abnormalities on MRIs for mild symptoms weren't linked to any treatable cause of dementia.
97% were basically benign findings.
Essentially, yes, but finding them caused so much worry that almost 12% of those patients were then sent for more invasive tests.
Like spinal taps or biopsies?
Yes, all based on an image that likely just showed normal aging.
I remember the case study of George, the retired engineer.
Right. 74. Worried because he was misplacing things. Standard cognitive tests. Perfectly normal for his age.
But he got the MRI.
He did. It showed those common white matter changes. He saw the report, panicked, convinced himself he had early dementia, and actually stopped driving.
Oh, wow. So the scan itself led to a worse outcome through fear.
Absolutely. The anxiety became the main problem, fueled by the scan result. His isolation increased, his confidence dropped. The sources strongly suggest that unless there are clear, severe neurological symptoms, seizures, rapid decline, a simple paper-based cognitive screen is a much better first step. #2, false alarms, and procedural dangers.
Okay, so we've seen how tests can medicalize normal aging. Now let's shift to tests known for high false positive rates, the ones that can send you down a path of risky procedures you didn't need.
And top of that list often is the cardiac stress test.
The one where you walk on a treadmill, often given for vague things like feeling tired or just not feeling like you used to.
That's the one. It's designed to find blocked arteries, but the data we reviewed shows its reliability really drops off in older adults.
How much does it drop off?
The false positive rate, meaning the test says there's a problem when there actually isn't, can be as high as 40% for people over 70.
40%.
Yeah.
That's almost half. So nearly half the time it might trigger an unnecessary alarm.
That's what the data suggests. And that false alarm isn't harmless. It almost always leads to more invasive follow-up.
Like an angiogram.
Typically, yes, where they thread a catheter up to your heart and inject contrast dye, which then often leads to procedures like putting in stents or even bypass surgery.
Based potentially on a false positive from the initial stress test.
Correct. And here's the kicker. A major 2017 study found that over half the stents placed after these stress test referrals gave the patients no actual symptomatic benefit. Their fatigue or whatever wasn't better.
No benefit, but they still face the risks of the procedure.
Exactly. Risks like bleeding, reactions to the dye, and a big one, kidney damage from the contrast dye.
Which is what happened to Roman, right? The 75-year-old retired postman.
Perfect example of the cascade. He mentioned feeling tired walking up hills. Standard stress test was positive. Led to the angiogram. They found a minor narrowing, put in a stent.
And the result?
He developed acute kidney injury from the contrast dye used during the angiogram, spent 6 days in the hospital.
And his original tiredness.
Turned out his doctor later figured it was likely just mild dehydration and needing a bit more rest. His heart wasn't the issue, but the screening process seriously impacted his kidneys.
So for vague fatigue, what are safer first steps?
A simple resting EKG, maybe? Or a coronary calcium scan, which is a low-radiation CT scan that looks for plaque buildup, can be much more informative with less risk than jumping straight to a stress test for nonspecific symptoms.
Okay, the next one in this danger zone might surprise people. It's the colonoscopy.
Yeah, this one often gets a reaction because it's been pushed so hard as the gold standard for decades.
But the sources argue that after 75, the calculation changes dramatically.
It really does. The risks, which are present at any age, just get amplified significantly later in life.
What kind of risks?
Well, first there's the prep. Those harsh laxatives can cause serious dehydration, electrolyte imbalances, even kidney problems in older adults.
Okay, the prep is tough. What else?
The sedation needed for the procedure carries higher risks for older brains. Confusion, sometimes prolonged cognitive issues.
And the procedure itself.
Higher risk of complications like bleeding after polyp removal, or even rarer but devastating things like bowel perforation, a tear, or heart rhythm issues during the procedure.
So more risks. But surely it still saves lives, right? Isn't that the point?
It does, but the balance shifts. This is crucial. A huge study in JAMA Internal Medicine looked at 1.3 million Medicare patients over 70.
Okay, what did it find?
For every 1,000 colonoscopies done on patients over 75 without specific high-risk factors, they estimated only 2 lives were saved from colorectal cancer.
Only 2 out of 1,000.
Right. But in that same group of 1,000, over 20 people experienced a serious complication requiring hospitalization.
Wait, So 2 lives saved versus 20 people harmed. That's a 10-to-1 ratio leading towards harm.
That's the stark reality presented in that study. The risk-benefit calculation changes dramatically with age for routine screening.
And Dana's story illustrated this perfectly.
Absolutely. She was 73, no symptoms, had previous scans that were clean, but she was pressured into getting another routine one. They found a tiny polyp, probably benign. During the removal, her bowel was perforated. Emergency surgery, a week in the hospital, 9 days of really tough recovery, all from a screening test she likely didn't need.
So what's the guideline now?
The U.S. Preventive Services Task Force actually recommends stopping routine colonoscopy screening at age 75 for most average-risk individuals. The risks generally outweigh the benefits after that point.
Is there a safer screening option if someone over 75 still wants screening or has concerns?
Yes, the stool-based FIT test, it's non-invasive, you do it at home, no prep, no sedation, no procedural risks. It's a much safer first step for screening in that age group. #3, the ultimate risk.
All right, we've reached the final test on our list, the one presented in the sources as potentially the most dangerous, especially when used routinely.
This is the annual full-body CT scan, often marketed as part of executive physicals or total health screenings.
Sounds comprehensive. What's the core danger here?
It boils down to one main thing: radiation. A massive dose of ionizing radiation.
How massive are we talking?
We're looking at maybe 10 to 20 millisieverts in a single scan, to put that in perspective.
Yeah, give us some context for that number.
Okay, the average person gets about 3 millisieverts of radiation just from natural background sources over an entire year. So one full-body CT scan can be like getting several years' worth of natural radiation exposure all at once.
Wow. Another way to think about it.
The sources often compare it to chest x-rays. One full-body CT scan delivers a radiation dose roughly equivalent to maybe 500 standard chest x-rays.
500. That's incredible. And this radiation exposure isn't trivial, right? There's a direct link to
Cancer risk. That's the really sobering part. This isn't theoretical. A 2023 modeling study published in JAMA Internal Medicine looked at the rise in CT use.
And the conclusion.
Their modeling suggested that the cumulative radiation dose from these scans, particularly when used broadly for screening, might now be responsible for up to 5% of all cancers diagnosed annually in the U.S.
5% of all cancers. Potentially linked back to a screening test.
It puts it on par with other known significant cancer contributors. It's a staggering thought, a test meant to find cancer potentially causing it down the line.
Okay, radiation is a huge risk, but isn't there another major problem with these scans just finding too much?
Absolutely. That's the other big danger, the incidentaloma problem. These high-resolution scans are so detailed they pick up tiny, harmless things.
Like what kind of things?
Little nodules, small cysts, bits of calcification in organs, things that are incredibly common, especially as we age, and almost always completely benign. Normal wear and tear, essentially.
But because they show up on the scan.
They have to be investigated. Once it's seen, the medical legal pressure is immense. So it sets off this chain reaction.
The cascade again.
The ultimate cascade. More scans, maybe peak-eat scans, which involve radioactive tracers, needle biopsies, which carry their own risks, blood tests, and immense patient anxiety and cost, all chasing something that was likely nothing to begin with.
Like Marcus, the 80-year-old martial arts teacher.
Yeah.
His story was striking.
Really highlights the danger. This guy was incredibly fit, active, paid extra for an elite checkup that included the full-body CT.
What did it find?
A tiny 3-millimeter nodule in his lung. Completely insignificant, most likely.
But they had to investigate.
They did. Recommended a needle biopsy, to be sure. During the biopsy procedure, they accidentally collapsed part of his lung.
Oh my goodness.
He ended up hospitalized, needed chest tubes, had a painful recovery that took 2 months. And the nodule,
Benign.
totally benign. The screening test, meant to reassure him, nearly debilitated him.
So what's the official stance from medical bodies on these scans for general screening?
Groups like the American College of Radiology are very clear. For asymptomatic adults, there is zero proven benefit to full-body CT screening, and there is significant potential for harm from radiation and the subsequent cascade of unnecessary follow-up tests and procedures. #tag synthesis and takeaways.
Okay, let's try to pull this all together. We've looked at dick X-ray scans, brain MRIs, stress tests, colonoscopies after 75, and full-body CTs. What's the common thread our sources are highlighting?
The core message seems to be this. When medical testing shifts away from targeted diagnosis, where you have specific symptoms leading the investigation, and moves into generalized routine screening, especially in older age, the equation changes. The potential risks often start to overshadow the potential benefits.
It's not that the tests are inherently bad, but their application in routine screening for asymptomatic seniors is where the danger lies.
Precisely. And it leads back to the central recommendation we saw again and again in the source material.
Which is,
Before you agree to any routine screening test, especially after age 70, the most important question you need to ask your doctor is, okay, what happens next if this test is positive?
understand the potential pathway before you take the first step.
Exactly. If the next step involves powerful drugs with major side effects for a marginal benefit, or invasive procedures to investigate something likely benign, or just confirming you have normal age-related changes, you need to weigh that against the potential harm of the test and the follow-up itself.
So it's about informed consent, but also informed refusal sometimes.
Or at least informed questioning. And shifting the focus. The sources emphasize that true prevention, the kind that really impacts longevity and quality of life, reducing falls, heart issues, cognitive decline, often comes back to the basics. Lifestyle. Staying physically active in ways that are safe and enjoyable, eating well, focusing on whole foods, prioritizing good, deep sleep. Those things have massive preventative power with essentially zero downside.
That makes sense. It's about proactive wellness, not just reactive screening. Hashtag tag outro. Well, thank you for joining us on this pretty challenging deep dive. We know this topic pushes against conventional wisdom.
It definitely does. But the sources raised some critical points we felt were important to share.
There's that old saying, knowledge is power. But maybe it's more accurate to say knowledge is most valuable when you understand it and know how to apply it.
Good point. So as you think about today's discussion, consider this. We've seen how the real risk sometimes isn't the initial symptom of aging, but the chain reaction kicked off by screening, driven perhaps more by fear than by clear evidence of benefit.
So the provocative thought to leave you with is, what other common health practices or checks, beyond the 5 we discussed today based on our sources, might actually benefit from applying this? Less is sometimes more filter, especially when we think about long-term health and well-being.
Something to ponder.
Definitely. We hope this gives you food for thought and empowers your next conversation with your doctor. Until the next deep dive, take care.